Hi, I'm Dr. Angelia Natili. I am a board-certified ear, nose, and throat specialist, otherwise known as an otolaryngologist. I am also a fellow of the American Academy of Otolaryngologic Allergy, very easy to say. And I'm here with Jennifer Wingler.
Hi, I'm Jennifer Wingler. I'm the allergy coordinator here at our office. Today we're going to go over some common questions that people have whenever they come to the office about allergies. Some people think ENTs only treat ear or sinus issues. Why would they see an ENT for allergies?
Well, we treat a lot of sinus issues, and sinus issues often stem from allergy. So it's a natural expansion of our practice to treat allergy, diagnose, treat, and relieve allergy.
How would someone know if their symptoms are due to allergies or something else?
Well, we have to test. We have to figure that out. Allergies have a common set of symptoms: itchy, watery eyes, itchy, runny nose, sneezing, especially when exposed to the allergen in question. Sometimes it's hard to suss that out because allergen is around you all the time if you're allergic to dust mite. Sometimes it's easier to figure that out if allergy is seasonal and it's only when the cars turn green that you are miserable and all the rest of the year you're fine. You probably have a tree allergy. So testing helps us to figure that out and help to get people the treatment that they need.
Okay. Is it worth getting tested if I've been managing my allergies with over-the-counter meds?
It is, for the reason that if the over-the-counter meds are perfectly managing your symptoms all the time, you may not even be allergic. So we need to figure out what you're sensitive to so we can treat you appropriately. The first thing is avoidance. So if you have a best friend that's got a cat and you have a cat allergy, then have a best friend come over to your house instead of going over there. So avoidance. And then medication. We want to optimize your medical treatment. If that is enough to manage your allergies that we know of, that we know about already, then if that's not enough, then we can talk about immunotherapy.
Okay. What type of testing do you offer, and is it painful?
So we offer skin prick testing is the gold standard of allergy testing, because you get an immediate response. In 20 minutes, you know exactly what you're allergic to. So, and we start out our skin prick testing, we use something called modified quantitative testing, very fancy word, but we start out with without any needles at all, with a little test thing like this. So, and we do follow up with some needles, but we often go on the back where you can't even see them. And so it's not painful. For select patients, we also offer a blood test.
Do patients have to take allergy shots forever, or are there any other treatments?
So patients do not have to take allergy shots forever. It is a commitment because we're changing the immune system. It is a big deal to change your immune system. So it does take 3 to 5 years to get that maximal benefit from allergy immunotherapy. But that 3 to 5 year commitment, you get 10 to 15 years of benefit that's persistent without shots.
Can treating allergies actually help sinus and ear problems?
They sure can. I have lost out on many sinus surgeries because I started immunotherapy for my patients, because their sinusitis, because it was based in inflammation, and we got calmed down that inflammation with our allergy immunotherapy, then I only see them once a year to check in on their allergy. I also like to mention, we don't have to do shots for allergy. We can also do sublingual therapies. There are FDA approved tablets, and there are also drops that we can formulate for each patient to concentrate on their specific allergens. That can be given to yourself at home once a day, as opposed to coming in once a week for 30 minutes. Some people would prefer to have that accountability, come in once a week, 30 minutes, they're done. Some people would prefer the flexibility of having home therapy.
Great.
Thanks so much for joining me, Jennifer, to have this conversation.